Hi, everyone, and welcome to What We Know About Campus Sexual Violence Perpetration and How to Prevent It. My name is Nastya Garadilova, and I'm the Training and Technical Assistance Coordinator at the New York City Alliance Against Sexual Assault. I'm really thrilled to be welcoming you all today. This is an Enough is Enough webinar, and as part of the Center for Training and Technical Assistance alongside the New York State Coalition Against Sexual Assault, and with the support of our funders at the Department of Health, we provide training primarily to Enough is Enough programs and rape crisis centers who are working with college and university populations. So I wanted to share that I'm particularly excited about today's webinar, and in the statewide needs assessment of all the programs that we did, we heard some interest in kind of diving deeper in understanding sexual violence prevention and really kind of understanding the root causes and how to address them. So I'm really hopeful that today we'll start a conversation that addresses what is, in my opinion, quite a significant gap in a lot of sexual violence prevention work and sexual violence work in general, which is thinking about really understanding perpetration dynamics of perpetration and how to target and work with those populations. So I'm thrilled to introduce Joan Tabachnik, who will be our presenter today. I want to take up as little of her time as possible. Over 25 years, Joan has developed educational materials and innovative prevention programs for national, state, and local organizations. Her primary focus is on preventing the perpetration of sexually harmful behaviors, particularly in adolescents and young adults. And Joan created the educational programming for Stop It Now before starting her own consulting practice. Since then, she has been director of NERI Press, the founding co-chair of the Association for Treatment of Sexual Abusers Prevention Committee, the executive director of the Massachusetts Society for a World Free of Sexual Harm by Youth, and is currently a fellow with the Department of Justice SMART Office, which is the Office of Sex Offender Sentencing, Monitoring, Apprehending, Registering, and Tracking. So thank you so much, Joan, for joining us. I will mention to folks that if you want to send questions through the chat box, I will be kind of collating them, and we'll have a Q&A at the end. And if anything is kind of particularly timely and relevant, Joan has invited me to hop in and share a question that comes in through the chat box during the training as well, so feel free to utilize that throughout. And also listen up for kind of Joan asking for some participation here and there. And I think without further ado, Joan, I'm going to turn it right over to you.
Wonderful. Thank you so much for that lovely introduction. And to say I'm very excited both to be able to be here sort of with you, virtually with you, Nastya, and also presenting, and also excited that so many people are interested in this topic. And before I even begin, I want to just say that, to note that I know that this topic is challenging for some folks, and it's sort of odd to say this in a virtual world, but please take care of yourself. And that can mean like just simply walking away from the computer if you don't like what I'm saying. Feel free to contact me afterwards with any questions. As Nastya said, put your questions in the chat box, and Nastya also can stop me, and also talk with each other. Both text to other people or afterwards, whatever. Just to I think that I always think of sexual violence sort of thrives in isolation. The more we can do to connect to each other, I think, is healthy. So please, take care of yourself through this webinar. And I think as most webinars sort of, and workshops begin, so we have these are the objectives, and the first is sort of talking about a framework of what we mean by preventing the perpetration of sexual violence, both what it means and also how that might influence your work. The second one is what we know about offenders, and particularly I'm talking about the SOMAPI Report, which comes from the Department of Justice SMART Office, and what it does is it summarizes the research that tells us what we know about known sex offenders, so about the adolescents and adults and children who have been convicted of some kind of sexual crime. So I just want to acknowledge, and I'll talk about this more, that's just a small subset of all the people out there who do cause sexual harm. And then I want to talk about some key campus intervention and prevention strategies, share some of those innovations, particularly around perpetration prevention. And I want to cover all of that in less than 1 hour. So it'll be a little bit of a fast-talking kind of conversation, but I grew up in New Jersey, so I'm used to the New York City pace of life. So please join me for the speed talking throughout, and please interrupt us with questions if you have them. So briefly, I just want to say that as Nasty said, I'm from the Department of Justice Smart Office on a fellowship right now, and the Smart Office is authorized by Congress through the Adam Walsh Child Protection and Safety Act of 2006. And basically the Smart Office is responsible for all of sex offender registration and community notification and creating consistent registry across the United States. It's also the only federal office that focuses exclusively on sexual violence, and it's the only federal office that focuses exclusively on those people who cause the perpetrators of sexual violence. So we're kind of we're small but very unique office. And the four key functions of the office is providing guidance on the Adam Walsh Act, technical assistance on the Adam Walsh Act, tracking legislative and legal developments, but also administering the grant programs. And that's what I'll be focusing on, with some of the grant programs that I think might be of interest to you all today. Also, I'm just curious, how many people, and if people know how to do this, how to raise your hands, but I'm just curious if you, how many people here have ever heard of the Smart Office or the National Sex Offender Public website? Do people know how to raise hands? And I'm not sure, Nasty, if there's an easy way of explaining that.
Yeah, there should be a little option to raise a hand if you look at the the right-hand side of your screen.
Okay,
I
so
see
a few
couple
people.
hands getting raised.
Yeah, so few people have heard of it. So it's not surprising that most people, I think, tend to not hear of the Smart Office. And the one that you may just find, one tool you might find helpful is this National Sex Offender Public website, and the URL is up there. And basically it's one tool that's helpful because it links, if you want to find out if anybody is listed on a sex offender registry anywhere in the country, you can find out the name. You can find out if somebody, individual is listed, or if you're part of a campus, you can find out if somebody is attending your campus. And I just want to acknowledge that, when so few victims ever report, and then of those victims who report, very few people then are necessarily convicted. So it's not a comprehensive list of everyone who ever has caused any sexual abuse, rape, downloaded child pornography, any of those sex crimes, but it's everyone who has been convicted of a sexual offense. So I think in that sense it may be a useful tool for some of you. So one of the things I think is important as I begin my conversation here, when we talk about sex offenders or we talk about campus rapists, that how we look at campus rapists or sex offenders affects how we develop our prevention programs. So maybe while I'm talking to this next thing, maybe if you could put in the chat box, when I say the term college rapist or I say the term sex offender, what are some of the thoughts or some of the words that come to mind as about that term? And I didn't want to refer back to that in a minute, so if you could just type those in while I'm talking as well. And in the chat function, and just basically, if you use like an image search and you do a search for sex offenders, what you get is truly scary images. And also if you do a search for college rapist, you get exactly what somebody just mentioned here, which is Brock Turner. So if you type in college rapist, you'll get Brock Turner, who was the rapist who was convicted of a brutal rape at Stanford. So what I would say is that you see some of these other terms that, as gendered as this is, a fraternity brother, usually someone who's known to the victim, who's an acquaintance or a partner. And if you do this more in a community setting, you're going to get people who, a lot more sort of graphic terms. So you're going to get things like, slum bag, sleaze bag, those kind of terms as well. Repeat offenders, and if you ask about people's emotions, you're going to get things like, somewhat, heinous. You get people's anger. And when you think about these individuals as monsters, then it's really difficult to start thinking that the people we know, people that we care about, or people that we're friends with, may be doing these monstrous things. And yet that is actually the portrayal that we have in the media, in the news, and in our conversations. So what I want to do is make sure that we talk today about not just the labels of sort of rapist and sex offender, but also talk about behaviors. Because if we talk about behaviors, then people begin to think more clearly about how to intervene. And that's what a prevention program is really all about. So the SOMAPI report, which I mentioned earlier, and the Smart Office is great with acronyms as the federal government, but it stands for the Sex Offender Management, Assessment, and Planning Initiative. And it provides, actually, if you want to know anything about people, either adult sex offenders or adolescents or children who have committed a sexual crime, this is probably the most comprehensive report that I've seen of the current research all the way through 2014, and that's about to be updated as well. It's a very long report, about, if you print it out, it's maybe 3 inches thick, but they also have a number of research briefs, executive summaries, as well as webinars So the specific topic you want to learn more about, you can do a deeper dive just by going into the SOMAPI report. And these are the various topics that are covered in the chapters of the SOMAPI report. And what I think is, in my mind, one of the most important things is that they break down what is known about adults who have committed a sexual offense and what is known about adolescents. And those are very, very different populations when you think about intervention. So if you think about it enough, from the victim's point of view, it really doesn't matter if the person is 12, 18, 25, or 40. The harm is still, and the trauma is still the same. But if you think about an intervention point of view, your intervention for the person who's caused can be very, very different. And for those of you working on college campuses, particularly for traditional age students, they are legally adults, but developmentally they're still adolescents. And so if you want to look at the research, I would suggest you look at the research around juvenile topics and look at what we know about adolescents. So that's actually much more applicable to the 18 to 21-year-old age group, which in the clinical world, thinking about it as transition age adults. And what I find is just if you want to take all that huge SOMAPI report and maybe narrow it down to 5 things, the 5 things that I would say are important to know is that when we think about preventing the perpetration of sexual violence, first and foremost, that prevention is possible. And most people actually don't think about it that way. And the Berkeley Media Studies Group did a research project about how media reports on sexual violence, and they found that only 5% of media reports had any kind of prevention story in it. So that the public, the people that you work with, probably need to know simply that prevention is possible. Second, I would say that it's really important to understand those who sexually abuse, and that's really key to prevention. Not only to understand the people who sexually abuse, but also understand what are the risk factors and what are the factors that actually lead towards perpetration. So particularly if you want to stop sexual violence before anyone is harmed. Third, I would say that not all people who abuse are the same. So we don't want to use a one-size-fits-all approach. So if you think about the images that we have, you think about sort of how we, and even when we talk about sexual misconduct, we tend to think it all about rape or maybe attempted rape, but there's a whole spectrum of behaviors. And the CDC, in a presentation really, and you can sort of see I have, again, the citation there in the left-hand corner, but they created, I think, a really wonderful way of thinking about both the type of sexual act that we're talking about. So they have, if you look at the horizontal axis there, so going from sexual touching and non-contact offenses all the way to sexual penetration. So there's a very different kind of acts that we could be talking about. And Jay Wilgus and Mary Cosson, who did a paper that talked about that there are actually 42 different types of behavior that would fall under sexual misconduct in most universities. They also talked about the tactics used, so that in addition to sort of what kind of act actually was perpetrated, they also talk about there's actually a variety of different tactics that's used as well. And this is moving from physical, this is the vertical, going from physical force threats or victim incapacitated by drugs or alcohol, all the way to sort of psychological, non-physical coercion or drug and alcohol used to impair or lessen the victim's resistance. So if you look at that, so then this begins to expand when we talk about sexual misconduct. It sort of expands our view of what we're talking about. And I would actually want to add in a third dimension here as well, which is really thinking about what do we know about the individual who is causing that sexual harm. So, for example, maybe if we're talking about someone who's stalking, is this a senior who is targeting a vulnerable freshman, has done that repeatedly? Is this a freshman who's never been away from home and is just trying to get up the courage to ask somebody out for a date? Or is this somebody who's maybe on the spectrum and needs someone to explain that no to dinner or maybe no to lunch also means no to breakfast and no means to studying together? And that they really, someone who's on the spectrum might need that kind of very, very concrete feedback, not from the person who they're targeting and stalking, but obviously from somebody else as well through an intervention. So it's clear, again, from the victim's point of view that the motivation doesn't matter, but from a treatment and from a management and intervention point of view, this is actually kind of important to understand. So that's the third piece of this of information here, 5 things to know. The other thing I want to say is that youth is still developing and that there's a lot of research which is showing that that youth are often on very different developmental trajectories, and that we actually can have a very big influence on that trajectory. So we know that that some youth will, so the reasons they sexually abuse may be very, very different. So if we're talking about someone who is 5 or 7, they may be acting out the abuse on the younger child that they've actually experienced themselves. There may be somebody who abuses once and then never abuses again. There are people who are escalating their abuse. But that we actually can find ways to intervene, especially the earlier they intervene, the better, that we can change that developmental trajectory. And last, I would say that, and this is something which I find when I work with people who are treatment providers who are clinical perspective, they have a harder time understanding that it takes more than just individual change. That's a great place to start. But we also need to think about how to change the environment. And I'm going to be circling back to that concept when I get to some of the prevention programs at the end. So what is prevention? And I think we're probably all pretty much on the same page. I'm assuming that most people sort of are familiar with the CDC definitions of primary prevention, which is about approaches that take place before sexual violence. And I like to actually not use the passive voice. I like to say not where it has occurred, but actually has been perpetrated, because it shows that there's a decision that's been made by an individual, but to prevent the initial perpetration or victimization. Secondary, which is immediate responses afterwards, and long-term is, or tertiary is then the longer-term responses after sexual violence. And I like that the CDC is often talking now about primary being before and then secondary, tertiary being after sexual violence has been perpetrated. And there's also the social ecological model, which I'm assuming, again, most people here are familiar with. But the idea from a public health point of view is that if you really want to make change, like on a college campus, that you want to make change on the individual level, the relationship level, the community level, and the society level. And we've done that with lots of other public health campaigns. So, for example, if you're looking at drinking and driving, that on the individual level we say, don't drink and drive. At the relationship level, we say, friends don't let friends drive drunk, or take away the keys. At the community level, we ask people when they're going out drinking as a designated driver, and we teach bartenders to cut off drinking when they see somebody might be drinking too much or if there's not a designated driver. At the society level, we have laws that actually will prosecute. So it really wasn't until we actually developed at each of these 4 levels interventions that really began to change the drinking and driving of around in the United States. So I'd like to sort of put those together into this prevention matrix and think about simplicity like before and after. So this is like primary as before, after being secondary and tertiary, and then looking at what can be done at the individual relationship level and what can be done at the community society level. And they've highlighted the after piece because that's where we as a society have really invested. And I would say, when I say we as a society, I'm saying Americans. I've had a chance to recently talk with some folks from Australia and was really moved by the fact that when they had the crisis in the Catholic Church, they realized this was not just the Catholic Church. This was a lot of organizations, a lot of different faith organizations and youth-serving organizations. And what's really amazing is that what they came up with was actually created a commission, a nationwide commission to look at what can youth-serving organizations do. And then they also devoted $400 million to creating standards for youth-serving organizations and to create prevention programs. And so when I say that we've, as a society, have invested in after sexual violence, it really is what we're talking about afterwards, after the abuse has been perpetrated. But I also want to focus about primary prevention, which is what can be done before anybody is harmed. And I want to, before I sort of jump into some of the specifics, I'm wondering just, if people, I know I'm blasting through a tremendous amount of information, and I wanted to spend some time talking about prevention, but I'm wondering if anybody has any questions about what I've said about perpetration. If people have any questions, so please maybe type that in there. I guess I can see that nobody has walked away, or not too many people have sort of walked away from the webinar, but I'm wondering if people have any questions, and if they do, feel free to type them in here, and I could take a pause for a moment to just see if people have questions here. And I'm not seeing any. Are you seeing any questions yet?
No, not on my end at the minute.
Okay. So please just know that I'm blasting through a tremendous amount of information here, and I think that if you do have some questions, please feel free to type them in as we go along. And I see actually one question here. We hear a lot of conflicting information about whether most people who perpetrate sexual violence are serial or one-time offenders. Do I have any thoughts about that? And there is I think, Amanda, you sort of pulled to along one of the bigger controversies, particularly around college campuses. And I think that particularly you're thinking probably about the work of David Lissack, who also and Jim Hopper, and also the work of Kevin Swartout. And so I think that there's what I think that research is pointing out, and I guess in my mind the way I look at it is that there are some serial perpetrators on college campuses, and those people who are serial perpetrators are committing a huge amount of the sexual violence. But if we're thinking about a prevention program, that we want to both identify those individuals, but that also that there's a huge number of individuals who are perpetrating once, and as I sort of talk about the different developmental trajectories, so that included in that there are, the different developmental trajectories, there are serial rapists. And so to say that it's not sort of one or the other, but I would almost say that it's both and. And if you look at that research, I don't see them as being necessarily in conflict with each other. That I think that we need to be paying attention that there are serial rapists and not ignore that. But I think also if we only pay attention to the serial rapists, we're going to miss the fact that we've got lots of people who are not fully understanding the idea of consent. We need to begin to, I know that most college campuses now have programs that they do right in the first week or during freshman orientation. But if we really want to stop first-time perpetration, we might need to start those kinds of programs actually in high school, even in middle school. So I don't see those particularly as conflicting pieces of information and research, but they actually are complementary. But we need to pay attention to both of those if we really want to prevent the harm in the first place. And Nancy also Schmidt asked, do we have any information about the ability to consent, such as where the lines when the victim's intoxicated or the offender is too? So, I think that's a really difficult, I think answer. It's a great question. It's a really difficult question to answer. And in terms of consent, I think that in terms of where the lines are, I think that there's no. First of all, I want to say there's no simple answer to this, and if there was, I think lots of people who are brighter and have been in this work much longer than I have will have resolved it. But at least the way that I think about this is that if somebody is drunk, that they cannot consent. If somebody is drunk, they actually don't know how to ask for consent either. And what there's some recent research which is showing out, which is beginning to show that that when sexual assault is perpetrated on college campuses, that often the person who's perpetrating is actually more drunk even than the victim. And to me, I guess if we're talking about sexual, if we're talking about, depending on which sort of sexual misconduct on the spectrum, if we're talking about a whole wide range, I think that I would like to see as equally a wide range of sanctions and interventions. And so if the only intervention we have is to expel somebody or suspend somebody, then it's going to be much harder to make decisions about what to happen. But if we have a wider range of sanctions, and I'll get to that in a moment, I think that we might have a better chance of moving forward and actually resolving some of these issues. And then there's the enough. I don't know if, Nasty, if you want to talk about the enough New York State policy that has around affirmative consent, and Nasty, maybe you want to jump in with that as well.
Sure. Kind of just, I know that this has been something that has been coming up a little bit, but the fact that there is, of course, the affirmative consent policy on college and university campuses in New York State under Enough is Enough, which is different to the kind of penal system requirements for consent. So that definitely kind of adds a complication to the question. So I did not provide any answers, but I did add a complication.
All right. Thank you, Nastia. So I'm going to jump ahead because I know we do have limited time. I want to make sure we get through some of the prevention solution pieces as well. And I just really like that when we start talking about preventing initial perpetration, that really has been part of the idea of comprehensive Prevention. And this is a quote from an article in 2007, that to address sexual violence prevention in a truly comprehensive manner, strategy to prevent its initial perpetration and victimization, so primary prevention, must reach the same level of efficacy and adoption as programs that respond to its consequences. And just honestly, we don't have that same level of research. But it's since 2007, it's been growing, so I want to be touching on some of those sort of innovations that have happened. And in terms of if we sort of think about going back to this in terms of the after piece, that there are policies directed towards sex offenders and also sanctions. And so the policy directed towards sex offenders, that folks might be familiar with the Clery Act, I'm sure. But under the Clery Act, the annual security report actually must include a statement that advises the campus community about where they can find information about registered sex offenders. So one of the things you may want to think about is that, are you familiar with where to find that information? That's something that's sort of maybe one action step that you could take when this webinar is over. There's also, I'm sort of encouraged by the fact that I think that a number of years ago there really was you can expel someone, suspend somebody, or have them write a paper. And I don't think we have enough sanctions, but we do have many more sanctions than we used to have. And so there's certainly, this is a summary that I pulled from actually that the Department of, within the Department of Justice, through the NIJ, has contracted Wellesley College, the Stone Center, to actually do a comprehensive evaluation of all of the different kinds of sanctions that are happening out there. And this is just some of the preliminary pieces that are coming forward. So you have a whole variety going from warning, law enforcement notice, loss of privileges, community service, no contact order, parental notification, schedule changes, apologies, awareness training, change of residence, sort of escalating a little bit more to his monetary damages, mental health evaluations, transcript location, psychoeducational treatment, as well as expulsion, suspension, and probation. So one of the things I thought was really, so one thing I want to mention is that the SMART office has it's a grant which they gave to Robert Prentke and Mary Koss, was to looking at creating two levels of sanctions based on what we know about sex offender treatment, and specifically the treatment of adolescents. And key to the intervention they're talking about is an assessment that can be used in the sanctioning process to help determine whether somebody, if somebody's going to either remain on campus or be able to return to campus after suspension. So that one level that they're talking about is the psychoeducational treatment intervention. So, and then where bigger issues are noted, that there also may be a higher level of intervention, which is a treatment program. And what I found, there was a study which was done in collaboration between the University of Michigan's Office of Student Conflict and Resolution and Sexual Assault Prevention and Awareness Center, the Center for Effective Public Policy, which is also the Center for Sex Offender Management, and also the Association for the Student Contract Administration. And what I found really, out of the informal study that they did, was that 79% of colleges do not assess the effectiveness of their approaches in terms of sanctioning. So other schools which do sanction, which almost all do, that almost all of them, so this is almost 80%, do not assess the effectiveness of their approaches. So one question to ask yourselves is, does your college do that? And if 20% did any kind of follow-up from the complainant to determine if they remained or if they graduated, and only 30% did any follow-up information about the students who were found responsible to identify if they engaged in any further sexual behaviors. So when we think about sanctioning and what's going on, what's out there, what we're actually falling woefully short on is actually, are any of the sanctions effective? And beginning to at least ask some questions and doing some follow-up with both the complainant as well as the student who's found responsible. So going back to the prevention matrix, I want to focus a little bit on where this perspective of preventing the perpetration of sexual violence might also have an impact in terms of bystander intervention programs as well as situational prevention programs. So in terms of bystander intervention programs, people probably may be familiar. So these are two programs at the college level which have been pretty extensively evaluated and found it to be effective, certainly through some of the work that was funded and through the CDC, the Centers for Disease Control. The first one here is a poster from bringing in the bystanders, which came from University of New Hampshire, and then the other is the Green Dot program, which is from Kentucky. And when I think about some of these different programs, what I've seen to sort of evolve over the past, really the past 10 years, is that these programs and many other bystander programs are beginning to start thinking about how to start thinking about the perspective of preventing the perpetration of sexual violence. And what I mean by that, I think I went to a NSAC conference this is the National Sexual Assault Conference, that's sponsored every year between Calcutta and the NSVRC, the National Sexual Violence Resource Center. And the keynote was talking about an effective bystander program and described a program, and I realize that I'm being very gender binary here, but that's sort of how the story was explained during the keynote, where a young man was taking was drinking a lot with a young woman. The young man was beginning to take the young woman back to his room. They both were clearly drunk, and one of the young man's friends intervened and made sure that the young woman got home safely with her friends, and the young man also got home safely to his room, and was talking about that, what a wonderful bystander intervention that was. And I absolutely agree, that's a great intervention. And but when you think about having the lens of perpetration prevention, partly what I want to also think about, like, who's having a conversation with that young man the next day when he's sober? Because obviously that evening is not the time to have that conversation. But who's having a conversation the next day about affirmative consent, which is required to talk about, in New York State, and who's having a conversation to really understand, like, what is going on for that individual, and does that individual need some additional sort of help, and would it be anything from maybe some substance abuse programming to maybe some help in terms of what it means to ask for a date. But there's a variety of interventions that can happen. But both having that conversation and how to have that conversation, and not to sort of say, like, I think that you might be you could if you keep doing this work, you might be convicted of rape. Might be they'd say, no, I'm not a rapist. So, but they say, like, have a conversation. I'm concerned about the way you're behaving around young women. It certainly jeopardizes my party, but it also jeopardizes your chance of actually having any kind of conversation or relationship. And that, and it's actually having that conversation, how to have that in a way to say, I'm doing this because I'm friends with you, because I care about you, as opposed to I'm doing this because I don't want you to be a rapist. So really beginning to talk about the behaviors and bringing in that lens of perpetration prevention. And if people are not familiar with the 2017 article about evaluating the Green Dot Bystander program, and I thought what was really wonderful, that beginning to look at that efficacy on the level of perpetration prevention as well. So here's a quote from the article. It says that Green Dot, as an effective intervention for reducing school-level violence, basically it's demonstrating that bystander programs has a bigger impact or impacts more on one violence form with a stronger effect for perpetration than for victimization. So I think that really sort of shows that this is incredibly important to think about if you really want to think about primary prevention, to say, like, when you do a bystander intervention program, are you also reducing perpetration as well as victimization? And moving on to sort of the, what I want to focus is on the community society level of primary prevention, so this is preventing perpetration, is that basically looking at the environment. And situational prevention is something which is actually, and this is if you look at the ecological model, this is looking what can be done at the community level. And situational prevention is a term actually used in the criminal justice world for many, many years, and there's like more than 50 years of successfully applying situational prevention to the issues of safer housing, as well as maybe 20 years experience of applying this to crime prevention more generally. And so what's happening now is that people are beginning to apply situational prevention also not just to crime generally, but also to sexual violence prevention. And for those who maybe haven't heard of situational prevention, I wanted to talk about there's actually sort of 4 different ways of thinking about risk. And I know that when people talk about risk reduction, when you talk about victimization, often people are concerned that risk reduction from the victim's point of view sounds like victim blaming. But when you start talking about reducing risk from a perpetration point of view, it makes actually, in my mind, perfect sense. So if you think about all these different, in terms of the situational prevention, it's actually, we want to think about how to reduce the risk at the environmental level for perpetration. And want to give you some examples when we talk about environmental risks. So start in the upper left-hand corner. So this is like what can be changed in the physical environment. This is access and lighting. And when I sort of heard about this, I sort of think about it. I live in western Massachusetts, in Northampton, right near University of Massachusetts, and which is a very large campus, 30,000 students. And when you go there, if you look at the and this is true of a lot of schools, that the freshman parking lot, like in rural campuses, you're allowed to have cars, and the freshman parking lot is the one that's just furthest away from the dorms. And it's also that when you have to walk back, that you have to walk back through some fairly poorly lit areas of campus, and and some people have even named that. So that's the rape lot, because that's what sort of people are so particularly vulnerable. So changing the access, changing the lighting, putting the most vulnerable students right up close to the dorms might make more sense, even though it's more prestigious for the seniors to have that parking spot. So that's just an example of environmental risk. In terms of policy gaps, to think about and really do a review about what kind of policies are in place. And then not just do you have all the right policies, but are people aware about the policies? And then even if people are aware of those policies, when those policies are violated, how does the institution respond? So if there's a violation in the code of conduct, do people know what the code of conduct is? But also, is there any kind of institutional response to that? If not, the policy really is null and void and doesn't have any impact. In terms of protective factors, that's like, are there any sort of training? Is there education? Is there supervision? And key, I think, to this is really the commitment of leadership in the campus. That one of the things I was really impressed with, I know that Meg Basson was a friend of mine. I started working at Williams College, and what I was really impressed with that was the kind of visibility that the Williams College president gave to this issue, and to the extent that they actually had a feature on sexual violence prevention in their alumni magazine. So they weren't hiding this; they were actually using this to show that Williams College is actually doing a tremendous amount of innovation and commitment to making sure that the policies are in place, those policies are enforced, and that they have the leadership and the visibility of their up through the president. And also looking at high-risk situations. So this would be parties, drinking, and there's in places where there's no supervision or monitoring, and just sort of imagine like if every party had like a sober monitor at every party. That's again one thing. Or and I think of that in contrast where again I live in western Massachusetts, right near also Amherst College, and folks may be familiar with the fact that one of the first cases that came forward around Amherst came from, in terms of visibility, was from Amherst College. And as a response, one of the things the college did was an audit of the college, and what they found was that on weekends that the only non-college age adults, there were only 2 non-college age adults on campus on a weekend, and this is a school of about 2,000 students. So that sort of creates almost a high-risk situation just by the nature of sort of not having any kind of monitoring or supervision from older adults. So how do we apply all this? And I think particularly, so noting sort of some of the unique features of the college campus, one of the things that having worked more generally on sexual assault and then coming to work in the campus environment, to say that alcohol use is associated with sexual aggression on college campuses, but the findings are mixed outside the campus setting. So when people say that the college environment is unique, and certainly I've heard that tremendous amount, there are certain elements that certainly the research is echoing as well. And there's a number of other research articles that I'm happy to sort of share if people are particularly interested in understanding more about alcohol in association with sexual aggression. So the SMART Office has given 2 different grants to explore situational crime prevention and seeking to sort of reduce the number of crime events by focusing on limiting the opportunities for that crime to occur. One of the grants was given to Dr. Kurt Bumby at the Center for Sex Offender Management, and the other is given to Dr. Keith Kaufman from Portland State University and Dr. Sarah McMahon from Rutgers University. And they each have taken 2 very, very different kinds of approaches. The first one is based on shifting boundaries, which I don't know if people are familiar with this particular program, but this was done in 300 middle schools in the Bronx. And they basically did in some schools they did nothing. Some schools they did just an educational intervention, which had a six-session curriculum. Some schools did just what is called hot zone mapping, which is looking at the map of the school and actually literally giving the kids green and red markers and saying, where do you feel safe and where do you not feel safe? And in the places where they didn't feel safe, they put in extra monitors and posters. And then in the schools where in some schools, the fourth sort of cohort of schools, they did both education intervention and the building-based intervention. And as you can imagine, that under the schools which had both the education and the building-based intervention, that they had the biggest decrease in the perpetration of any kind of harassment, sexual assault. But what was remarkable from the study was they found was that when they did just education intervention, they found any of the 6 sessions, they found almost no change. But when they did just the hot zone mapping, they found that they had almost the same level of reduction of perpetration as when they did both education and the hot zone mapping. So what the Center for Sex Offender Management and Kurt Bumbing are doing is they're testing this hot zone mapping at 3 different universities, and they've kind of updated a little bit. So they have not just these red and green markers. So this was done in 2013, but they actually updated this, and they have a whole variety of different sort of like a sticker book that they can create, and people can put down everything from noise levels, decibels, heat, touching harassment. So it's just not just red and green, but really like in red and green, all these different levels. And they're finding that there's actually can show that there's been a concentration in certain areas, and they can find that maybe by reducing the decibels on a dance floor, that you actually can have an impact on the levels of harassment that happen in that same specific area. The other model that Keith Kaufman and Sarah McMahon are using is something that was actually that there's a lot being done within youth survey organizations around situational prevention, and particularly around Boys and Girls Club. Keith was doing a project. I'm sorry, with Big Brothers and Big Sisters. Now I'm remembering it, so I actually had the wrong logo up there. Sorry about that. And what he found was that when he asked people about what are some of the risk areas in their facility, and then he went through actually a checklist, an actual protocol about going through what are the things. They found that when he went through the protocol, they were able to identify 7 to 10 times more risk areas, and also as a result, 7 to 10 times more solutions of how to have an impact on the facility and the environment where the Big Brothers and Big Sisters are working. So that is being also tested in the college environment, and they're looking specifically at what can be done in athletics, what can be done in fraternities, what can be done in 6 or different settings around the campus. So just want to say maybe just in closing here, and this might be a good way to turn this sort of back over to you, Nastia. But I'm curious, like maybe as we're going through this, maybe it's like given what I've said today, learned today, is there any action that you are willing to, or you think you might want to take, and as a result that might have maybe looking at preventing perpetration and sort of taking on that focus, and that could be anything from what I said in terms of just like checking the National Sex Offender website, or it may be something that looking at what you're doing in terms of sanctioning, in terms of effectiveness. So they also may be looking at how to make sure that your bystander programs are looking at perpetration and have a conversation with someone who might be at risk to perpetrate. So I'm going to turn this over to you, Nastia, to maybe go through your what you're doing in terms of evaluation, and maybe in the meantime, maybe you can be typing in some answers to what you've learned today. Is there any action that you might be exploring or thinking about taking?
Thank you so much, Joan. But before we dive into a bit more of a Q&A conversation, I did want to ask you to talk a little bit about your understanding of accountability. I know that it can be really challenging as folks who work in the sexual violence field to kind of sometimes sit with the feeling of, with the understanding of sex offenders as human and those who perpetrate harm as, also needing thoughtful interventions when most of us focus so much on those who have experienced harm. So I'm wondering if you could talk a little bit about the difference between accountability and punishment as you understand it, and how kind of more understanding of those who perpetrate harm does not actually mean less accountability for them.
Yeah, sure. So I think that it's, I think that often that we sort of think about the only sort of solution we offer in terms of accountability is punishment. And so the first thing I would say is that often we don't ask victims what they want. And what we're finding is that often, like I think that especially that there's some really wonderful people who are exploring these kinds of questions from the victim's point of view in terms of like what do victims want, and not all victims want the same thing. And so I think that when we think about if all we think about is accountability in terms of punishment, then we're not actually offering enough options for victims either. And what I find, at least in terms of the work that I've done with, and working especially with clinicians who work with kids with sexual behavior problems, and when I say kids, I'm saying literally to adolescents, and that what we find is that there's almost what's hard to hold, I think, for a lot of people especially who work with victims, is that that the intervention that we want for the person who caused the harm might vary dramatically depending on who that individual is. And so as I mentioned sort of earlier, that there are individuals who, and I think remember a call I got from college where there was somebody who is on the spectrum and didn't really fully understand what they were doing, and the intervention that you would have for that individual is very, very different for somebody who's very conscious about what they're doing, both in terms of what's possible, and then if you're also talking about the behaviors or whether or not they're compulsive or impulsive, that also has a very different kind of intervention. So what I want to say is that we sometimes need to think about not victim or offender, but we want to say how do we make sure that the offender is being held accountable, the person who is found responsible is being held accountable for what they've done, but also that make sure that accountability both addresses what some of the times the victim wants, but also that accountability allows that person to learn how to live safely in the community, because what we want as a community is for that person to not just experience punishment, but we want that individual to learn how to live safely so that there won't be any future victims. And that, I think, is that holding both of those is something very hard, specifically when living and working in a small community. But I think when I think about what ultimately is keeping our community safe, and I think one of the keys to that, in my mind, is making sure that when we think about the harm that's being done, that not just think about it in terms of the individual victim and offenders, but that when that harm is caused, that it's not just the victim who's harmed, it's that whole community. It's the people who care about that victim, and also the person who cares about the people who care about that offender. That also the same thing is so that when we think about the repair that needs to happen, it's in that larger circle of people as well. So I'm not sure if I've actually answered your questions. I'm not sure there actually is an answer, but I think that part of the answer to me is looking at that broader picture of how do we ensure that going forward that there is community safety, and how do we make sure that the impact is not just about the victim, but the impact is on the whole community that has been harmed by that particular act.
Yeah, no, that's really helpful. Thank you. Something I often try and kind of remind myself is that for many folks, punishment is passive, and accountability is actually a lot more active. So it's a lot harder to you can't really force accountability on somebody, which makes it a scarier goal in that way, because punishment you can force upon somebody, but how is that kind of serving the goal of prevention of perpetration in the long term as well? So I've gotten a few folks to the chairperson in the chat. If folks want to I've gotten a few questions. If folks want to keep asking questions in the chat, I just wanted to do a couple of quick eval questions. So if people want to, if you're on your email, quickly turn back to the Ready Talk page. It's just a couple minutes, but the first question is whether or not this training has encouraged you to do something differently in your primary prevention work. So I'll just give folks a couple minutes to respond to that on kind of a strongly agree to strongly disagree scale. Got some answers coming in. Thank you, everybody. Just give it another minute. And if folks want to, in the meantime, also type questions into the chat box, we'll turn to those right after this. Great. Thank you. Still got a couple coming in. Awesome. Thank you, folks. And if we have a look as well on this training, increased my knowledge about perpetration of sexual violence, if y'all could reply as well on the strongly agree to a strongly disagree. Give it another moment or so. Thanks, everybody. Great. Thank you, folks. You guys still see some coming in? Cool. And finally, if you learned something new from this training, thank you, everybody. And actually, I was kidding. This is the next one is finally. But if you are interested in learning more about this topic, and this can kind of inform our programming moving forward as well. As I said at the beginning, definitely see this as the start of a conversation, and if y'all are interested in continuing it, we are too. Great. Thank you, folks, so much for responding to those questions. There'll be also an opportunity once you exit the webinar to add any comments or thoughts, but I do want to save some time to go through some questions, Joan, that have come in with you. So firstly, somebody asked that funding for services and resources focusing on offending students is so limited. So do you have any suggestions maybe to, what strategies can encourage help-seeking behaviors for those at risk of perpetrating sexual violence? Or kind of how do folks manage the difficulty where most funding only allows you to work with those who kind of report being abused? Yeah,
so I guess a couple things I would suggest. I mean, one is that, I have two kids, one who's in college still, and so because I'm not sure for those of you probably whether you have kids or not, or or depending. But when you do this work, I'm sure you get lots of phone calls, and so I got a call from a friend of my daughter who was just concerned about his own behaviors. So this is. It was actually not on college, but sort of over a vacation. And when he went to his campus services to sort of talk about what happened, the campus counseling service said, "Go, please talk to a lawyer. Don't talk to us." And so I guess first I would say, one of the things I would say from a prevention point of view is that making sure that your counseling services knows how to deal with if somebody comes forward saying, "I'm concerned about my own behaviors," and understand what the limits of their confidentiality are, but also know how to respond to that individual. Because in this case, what I really encouraged this young person to just to not stop there, but and not to go talk to an attorney, but actually talk to another, keep talking to different counsels until they found someone who could talk to them about what had happened, what they did. So first I would say focus a little bit on sort of making sure that you have the resources available to those people who might be reaching out for help, concerned about their own behaviors. I also know that there's a number of, depending on where you're located in New York, and this is New York City, most of the folks here might be from New York City, but even if you're in New York, that there are clinicians who work, who do this work in terms of working with either adults with sexual behavioral problems or with kids with sexual behavior problems. And sometimes having somebody in the community as a resource might be helpful, just as to be able to consult on particular cases or particular situations as well. There's also a growing number of campuses who have services, respondent services. So they have somebody who's designated, and I think a lot of people start thinking, well, when you think about all the services, you don't want to have identical services for victims and for people who either might be accused or found responsible. They need very different kinds of services, and certainly the same people shouldn't necessarily be providing those services. but there should be something. And so is there somebody on your campus who is assigned to deal with those, with anything that might come up for somebody who has been accused, or for somebody who's been suspended and coming back to campus? Is there a list of resources on your campus? And are those people sort of trained to understand how to maybe to look at those and make sure that there's a safety plan for that individual who's found responsible, or maybe who has been accused, and making sure that they have the tools as well. And so even though there's not funding, there are resources in the community, and there's also ways of sort of using some of the limited resources on your campus to make sure that there are separated resources for both. There's a couple of, I was at the NASPA conference this year, and heard a great presentation from the University of California Systems. And so if you go onto basically anybody in the University of California Systems on their website, you'll see there is actually a whole section for respondent services. So that may just be another model for something to be thinking about as you're thinking about creating resources, or at least creating sort of a portion or a pocket within your campus to deal with respondents.
Yeah, thank you, Jen. I like that you framed that there should be resources for both, but they don't have to be the same. And I think oftentimes folks misconstrue that Title IX is saying equal resources when actually it's saying equitable resources, kind of that key difference in those two understandings. I do want to fit in this question as well. So, Joan, if you have any suggestions about how to kind of sell this idea or this perspective to those who might more firmly hang on to a black and white view of perpetration and kind of this idea of all perpetrators as monsters that you were talking about at the start of your presentation.
Yeah. I mean, I think that, so first and foremost, I guess I would say, that often when people have that, it's coming from their own place of anger or trauma, and so there's sometimes that people need to stay in that black and white place, and so I don't feel like whenever I sort of talk about this, it can change everybody. But usually when I talk about this, I think if you're talking about college campuses, I think that really thinking about that. I think that what I referred to earlier, the work of Mary Koss and Jay Wilgus and others, are talking about these 42 different behaviors. So when you start talking about sexual misconduct, that we're not just talking about rape, we're talking about a whole variety of behaviors. And as soon as you can start teasing out the fact that this is not a one-size-fits-all approach, that we're talking about a whole variety of different behaviors, and we're also talking then a whole variety of different kind of motivations and understanding. So to treat the freshman who has never dated, never been drinking, never been away from home the same way as you deal with a high-status senior who is being predatory on vulnerable freshmen, as soon as you can start beginning to tease out those different people, that people can sort of start moving a little bit out of the black and white. And I think the other piece I'd say is that what I try to do whenever I talk about the differences with people who have caused the harm, it's really important to acknowledge that that from the victim's point of view, it really doesn't matter what the motivation is, but from an intervention and a prevention point of view, it's really critical that we begin to understand exactly those differences, so that we can have better interventions, because a one-size-fits-all approach won't actually have an impact on anybody. We need to make sure that we have interventions and prevention strategies that are really targeted to each of those different kinds of individuals. So I know we're sort of short on time, so that's a very quick response, but I'm hoping that, and again, I'm happy, for Brian, if you want to sort of, I think at the end of my slideshow, there's my contact information, so feel free to, email me if you'd like to have a little bit deeper conversation about that.
Yeah, thank you so much, Joan. I'm aware that we're at time as well, and definitely interested in continuing this conversation, so hopefully we can do that moving forward. But thank you so much for joining us. I think it's such a critical and challenging perspective to think about expanding our idea of prevention to also focus on kind of what causes perpetration and how we can address that without being victim blaming in any way. And kind of I like your framing of risk reduction for perpetration, not for experiencing sexual violence, and kind of how to reframe that a little bit to better prevent. So thank you so much, everybody. I'm going to stop the recording now, and we hope to see you on our next webinar. Thank you, Jen.
Great. Thank you so much for inviting me. It's really been a pleasure doing this.
as it has for us.
Take care.
Bye, folks.